Good morning, everyone. It gives us great pleasure to have with us today Dr. Mujeeb Shaik from Thumbay University Hospital to give us an enlightening session about the health risks of a sedentary lifestyle. And Dr. Mujeeb will focus on low back pain management, as this is a problem that a lot of people are facing. So, Dr. Mujeeb, we are pleased to have you with us. The floor is all yours.
Thank you very much. Uh, Good morning and salam alaikum to all of you. My name is Dr. Mujeeb Shaik. I am consultant orthopedics. Today we are going to talk about health risks of sedentary lifestyle, low back pain management. So as you are all aware, nowadays we are leading a hectic lifestyle, and most of the time we are busy with our schedules, and lots of people will be thinking that they don't have enough time to do any exercises or to participate in sports. So that leads to various health problems. So the sedentary lifestyle causes multiple health problems, including heart diseases, diabetes, high cholesterol, obesity, psychosocial issues, and also musculoskeletal problems, including low back pain. So being orthopedic surgeon, today I want to discuss with you about how the low back pain happens and what are all the treatment options we have, and more importantly, how to prevent low back pain. So that's going to be our core topic. Before we go in detail about low back pain, I want to give brief introduction about the anatomy also. So low back pain is the most common complaints in outpatients. So nearly 90% of the adults will have had back pain at least once in their lifetime. It is such a common complaint. And it is one of the most common reason for work-related disability. So lots of people take off from their work because of the attacks of back pain. So coming to the spinal anatomy, the spine is a central bony part of the body, which is lying on the back side of the body, and it provides support and it allows movements for the body. It allows forward bending, backward bending, and at the same time, it protects the spinal cord and nerves, which are the vital structures in our body. So this is made up of, the spine is made up of three elements. One is a spinal column, which is the bones and discs. And inside the bones and discs, we have neural elements, spinal cord as well as nerves. And surrounding the spinal column, we have muscles and ligaments. All these constitutes the spine. So that's the bony anatomy. You can see the bones, what we call vertebral bodies. So in between two vertebral bodies, we have a cushion, what we call intervertebral disc. So this is the important cushion that's going to help us in taking the impact activities. It acts like a cushion, shock absorber, and it also helps in the flexibility of the spine. So this disc can get worn out with age and with our activity, and can sometimes even slip, causing pressure on the nerves. And then we have soft tissues of the spine, which includes ligaments connecting the bone. Ligaments are like the ropes connecting the bones. And also we have small joints on the backside of the spine, which we call facet joints. So those are the facet joints. They also helps in our spinal flexibility. So these joints can become arthritis with the time, and they also cause stiffness and pain in our spinal movements. Now coming to this slide, this is very important slide for you to understand. The spine is surrounded by muscles, what we call core muscles. So there are muscles on the back side, which are called paraspinal muscles, and also the muscles of the abdomen, the muscles in the front of your belly, abdominal muscles. These are also very important muscles to maintain the stability of the spine. So people who got pot bellies, they will have weak abdominal muscles that can lead to more back pain. So we need to strengthen both the spinal muscles on the back side as well as the abdominal muscles in the front. So in the spine, like now you know that it is made up of bones, it is made up of ligaments, it is made up of disc, and it's made up of muscles. So all these parts of the spine can give you pain. So pain low back pain is usually multifactorial. So any of these component can give the pain. So that's why it's very difficult to completely eradicate back pain. Only we can do is we can reduce the pain to the significant level. So I want all of you to concentrate on this side. This is the slide demonstrating the pressure in the disc at various postures of our body. So if you measure the pressure in the disc when you are lying down, the disc is like a cushion between the bones, like I already mentioned. If you take a pressure sensor and measure the pressure will be lowest when you are lying down, moderate when you are standing, highest when you are sitting. So if you can see that in lying down posture, it is 25, in standing posture, it is 100, in sitting posture, it is 140. So if your job involves too much sitting, you are at risk for back pain. Okay. Apart from this, bending forward will exert more pressure on the disc. So people who are bending forward and lifting weights, they are more prone to develop back pains and also slip discs. The disc can slip and cause pressure on the nerves. So what are the types of back pain we can get? Fortunately, most of our back pains, what we call simple back pains, they are pains due to the strain on the muscles or the ligaments, and usually it does settle down with medicines and rest. Very few patients develop what we call serious back pain. It's only less than 1%. So this back pain is due to cancer, infection, or sometimes fractures. Okay. Apart from the spinal problem, sometimes you do get back pain because of other parts of the body, like the abdominal problems. If you have a kidney stone, you can get back pain. If you have a liver problem, you can get a back pain. If you have a pancreas problem, you can get a back pain. So most of the structures in the abdomen, if there is any problem in that one, that gives what we call referred pain in the back. So in those cases, if you do X-rays, MRI scan of the spine, it will all be normal. So until and unless we identify the abdominal problem and treat it properly, your back pain is not going to go away. Again, the most important thing you need to understand is in some people, you get very severe back pain, but still the problem may be a simple muscle sprain. And in some people, you don't get any back pain at all, or maybe little back pain, but they may be having cancer in the spine. So the severity of the pain doesn't mean that you have a serious problem. So many people think that if they get very severe pain, they think that something is terribly wrong in the spine and that has to be dealt by only by the spine surgeon. No. Most of the time, even though the pain is severe, the problem may be simple, like muscle sprain. Okay. And most of the severe pains can be well handled by the general practitioners and emergency doctor. You don't need to see specialist each and every occasion when you get the back pain. So how do we identify whether your back pain is a simple back pain or serious back pain? This is how we identify. We look for the red flag signs. When you attend any GP clinic or emergency, the doctor wants to know whether your back pain is associated with fever, or is there any history of trauma?
Then what I will say something.
Did you develop this back pain following a trauma, following a fall, or do you have any history of cancer? These histories suggest that your back pain is a more serious back pain. It needs immediate investigations and interventions. If you don't have these red flag signs, you can safely be treated with simple painkillers and rest. So the doctor who is going to evaluate on the first instance, he's going to rule out these things and then do the treatment. So when you decide it is a simple back pain, then the treatment will be different. If it is a first time back pain, you just need medicines and rest. But if it is a on and off back pain, some people will get back pain for long duration, for months, for years. So those back pains needs specialist attention, not on urgent basis, but as the OPD is available to you. So the treatment for these patient is we need evaluation with the X-rays and MRI scan to see if you have any weakness in your bones, in your discs. Sometimes your spine will be completely normal, still you will be having long-standing back pain. In those situations, we need to see whether it's due to any psychological effects. If you are too much overstressed, or if you are too much depressed, or if there is any issues with your poor job satisfaction, or if you have any work-related issues. So those things can also affect your back pain. The back pain is very much affected by your psychology. So we need to identify those problems to treat the back pain. So this is how we identify yellow flag signs, we call it. So if you are having some problem at work, poor job satisfaction, or if you are a depressive personality, or if you are a overstressed personality, or if you have a family who is overprotective, or sometimes you don't have enough support at home. So all these things will lead to persistence of the back pain. Or if your job is lifting heavy weights, or if you are working at out of hours, so all these things will affect your back pain, because although there is no problem in the spine, the psychology will affect. So for that one, the treatment is different. Giving medicines is not going to help him. So we have to identify that problems also. So now all of you can evaluate whether you are at risk to develop chronic back pain. So if you are a smoker, because in smokers, what happens, the blood circulation to the muscles, to the ligaments, to the discs will all be affected. The blood circulation will be poor in smokers. So when there is a poor blood circulation, the tissue healing potential will be poor. So even minor trauma will give you persistent pain. So in smokers, they always tend to have long-standing back pain, and it will not get better with the simple medications or even surgeries. They may fail until and unless you quit smoking. Overweight is another issue. If you are overweight, you put more strain on your discs, on your bones, on your muscles. So that leads to back pain. If your job is prolonged sitting, so like people who are working uh, in the receptions, who are working in the customer care, calling centers, so they are all prone to develop back pain because they will be sitting for prolonged hours continuously in the same position. So frequent travels, if your job involves too much traveling, or you are traveling to your workplace far away. So I see lots of my patients who are living in Ajman, but they will be working in Jabal Ali, they may be working in Dubai, Abu Dhabi. So they do daily travel, daily morning 1 to 2 hours traveling, evening coming back 1 to 2 hours. This puts a lot of strain on their discs, on their back, and that can cause permanent damage to their disc, and they will have back pain all the time. And now the most important is, if you do not regularly exercise or engage in sports. So if you lead a sedentary life and you are not active in sports and exercises, you are prone to develop back pain because your muscles will be stiff and weak. If your job involves frequent bending forward, twisting movements, lifting heavy weights, like manual laborers or domestic cleaners, they are all prone to have the back pain. And the most important is, if you are a person of hurry nature, if you are a stressed out personality, you want to do everything fast, everything quick, you end up hurting your back. So whenever you have to lift any heavy weight, you have to take your time, plan how to lift it, position yourself, and then lift the weight. So how you can prevent back pain? And if you identify all these risk factors, then it's easy to prevent. So if you are a smoker, you need to cut down or stop smoking. That's the only way you can make a difference in your back pain. If you are overweight, try to lose weight. The best way to lose weight is dieting and exercise. Diet will contribute 70% for weight loss. Exercise contribute to 30%. People think that if I do exercise, that's enough. No, diet is much more important. And if you are frequent traveler, you need to avoid. Okay, I tell to all my patients who are living in Ajman, working in Jabal Ali or Dubai, I tell the best thing you can do to yourself is try to live close to your workplace. I know it's difficult for their family circumstances, but if they want to really help themselves, they should avoid traveling. Because once you develop back pain by traveling long distance, that's it. It's going to stay with you forever. If your job is prolonged sitting jobs, you have to take breaks. Don't sit continuously more than 1 hour. Every 1 hour, you get up, walk around for 3-4 minutes, come back and sit. That gives you relaxation for your muscles, and it gives time for your discs to regain the height. When you're sitting, the discs will become flat, flat, flat in your spine. So if you get up and walk around, the disc will take the water from the surroundings, and again it will regain its height. And every time you get up and sit back, you maintain proper posture, because your posture, once you sit, automatically you adopt bad posture with time. So every time you get up and come back to sit, you get back your proper posture. That's the advantage of taking breaks. And avoid frequent bending forward and avoid lifting heavy weights. Okay, avoid lifting heavy weights in rush. Don't do everything in rush. Do it slowly as planned. And you need to have regular exercises. The exercise, it could be a simple walking, 1 hour walking, at least 3 days in a week. I would say that's the minimum. So if you can walk daily 1 hour, that's very good. Otherwise, swimming is a very good exercise for the back pain. And get involved in any sports activity. May not be high impact activity, but simple sports activity is good. The other reason for the back pain in this part of the world is vitamin D deficiency. Although we have a lot of sunshine around, we rarely go into the sunshine. We try to stay in the shades all the time. And especially the dressings, uh, we put cover all the body. So there is no sunshine exposure to our skin. So to get adequate vitamin D, you need to have at least your face exposed and neck is exposed, and the arms, at least up to the forearm level, should be exposed for at least 15 to 20 minutes a day. That is the minimum recommended sunlight exposure to get adequate vitamin D per day. So if you don't have adequate vitamin D, you end up having body pains all over your body, including uh, tiredness, weakness, multiple bone pains. You feel pain in the spine, pain in the pelvis, everywhere. So unfortunately, there is no diet with which you can get your vitamin D back. The dietary sources are always having insufficient levels. There is some vitamin D in dairy products like milk and also in the seafood, but still it is not sufficient. So either you have to get exposed to sunlight or you have to take supplements. That's the only way you can make up your vitamin D deficiency. So poor posture is the most common cause for the back pain. So you can see various bad postures in this slide. So the correct posture is standing straight with your shoulders pulled backwards and head upright without bending forward, so that your ears, shoulders, and pelvis are in one line. So that's the correct posture. But most of the times we see people either neck bent forward or shoulders coming forward. So this is what we call stooping posture. So that's mainly because of our poor habit rather than anything wrong in our body. So how to correct this posture is you need to practice to maintain good posture. You need to remind yourself to maintain good posture. So every 15 minutes, you need to look for how I am sitting. Am I sitting my neck completely bent forward, or my head is right on the top of my shoulders? So you look for your posture, you remind yourself to correct posture, and then carry on working. Again, after 15 minutes, again, you check your posture, whether you are sitting in the right posture or you are again bent forward. So like that, if you keep reminding yourself, the body will automatically adjust and adopt correct postures. That's one way. The second way is you can practice at home. You have to walk in a straight line with shoulders pulled backwards and head on the shoulders. Sometimes we do even recommend to keep a book on the top of your head and walk so that the book doesn't fall. So there are various exercises to stretch and strengthen to maintain the correct posture. I'm going to show those exercises in my next slides. Again, the sitting posture. This is also very important. A lot of people will be sitting in really bad posture. So the sitting posture, ideal sitting posture, you will be sitting all the way back in the seat. So that your back should be touching the back of the seat, and the back support should be at least up to your shoulder blade levels. So some people will have really low back support. That's not enough. The back support should come up to your shoulder levels. And this height of the chair. So the chair should not be at the very low level. It should be at least the length of your knee to the foot. Whatever length, the height should be up to that level, so that your foot is comfortably resting on the floor. And then the height of your computer. So the top end of the computer screen should be at the level of your eyes. So that is what the recommended position. And you should stay a little closer to the table, to the workstation, so that you are not going to bend any more forward. So all the time you will be sitting straight and working. So that's the important one. And then if you are using telephone like a call center people, you should refrain holding the phone to your ears, because that adapts with bad posture and you end up having the neck pain. So the best way is like what I'm doing now. You need to have the headset with the earphones and keep your both hands free. So if you don't have the headset, if you have to use the phone, don't stay in one posture, keep changing your phone between right ear to left ear. And like I already mentioned, if your job involves too much sitting, you need to take breaks, multiple breaks, every 1 hour, at least 4 or 5 minutes break. So that reduces your tension, so your muscles will be relaxed and you will also be less stressed, and you can maintain good posture every time you sit back, and it makes you refreshed so that you can do more productive work. So driving in the car, again, the same thing, sitting posture. So you'll be sitting all the way back in the seat. You should have a back support if you are already having back pain, and try to stay a little closer to the steering so that you are not going to bend too much forward. Now, these are the various back exercises we do suggest for the people who are having back pain. My favorite exercise is the number 2, which is a bridging exercise. This strengthens your core muscles of the spine, paraspinal muscles, and the plank exercise, which is number 5. This strengthens your whole body muscles, especially the abdominal muscles also. So you can choose 2 to 3 exercises out of them and do at least 10 to 15 reps, both in the morning and in the evening. So these are the various stretching exercises. The previous slide was showing the strengthening exercises, and these are more stretching. So we need to do both. We need to stretch the muscles. We need to strengthen the muscles. So how do we manage back pain? So we know how to prevent it. So we learned all the exercises. So we know how to maintain the posture. So if you get a back pain, how to manage back pain? So again, depends on whether your back pain is of short duration or long duration. If it is a less than 6 weeks back pain, so all you need to have is a short duration of rest. So people come and ask me, give me 1 week rest, 10 days rest. No, you need hardly 2 to 3 days rest. As soon as your pain is getting better, you should return back to work, because the early return to work makes your back pain disappear quicker. And most important is avoid pain provoking activities. Now you know when you get the pain. The pain is more if you are sitting for a long time, or pain is more when you're bending forward and twisting movements and lifting weights. So you should avoid those activities. Avoid prolonged sitting, avoid prolonged driving, because in the driving, you are not only sitting, you are having vibration. So that will damage your disc. So avoid too much traveling and avoid bending forward and lifting weight. So these are the most important things you have to do when you have back pain. Okay. And medications will also help for quick return to work. If you are taking pain medicines for few days, there is no harm to your body. So people get worried that we don't want to take painkillers. No, it's if you are taking for 1 week, 5 days, it's absolutely fine. If back pain is more than 6 weeks duration, if you are the person who are getting back pain again and again, then we need to know the cause. Is there any defect in your spine, any defect in the disc, or any problem in the bones? So for that, we will do the evaluation with X-rays, MRI scans. So the management for chronic back pain is more different. So here we arrange physiotherapy, which is a structured exercise program to strengthen your muscles, to correct your posture, to stretch your tight muscles. So these exercises we do one-to-one supervised exercises. Sometimes we do in a group exercises. So apart from physiotherapy, the other modalities of treatment for chronic back pain is manual therapy. Sometimes we do massages, mobilization, manipulations. Okay, acupuncture is also a best treatment for chronic low back pain. And all these therapies, we have to combine if there are any psychological issues or occupational issues. If you have a problem with your occupation, whether your job is too many hours or out of hours, or if it involves too much lifting weights, we need to adjust that job. Or if you have psychological issues like you are overstressed personality or depressed personality, we need to treat that one either by counseling or by medicines. We have to combine this physiotherapy, manual therapy with your psychological or occupational therapy. Then only we can get rid of your chronic back pain. So chronic back pain management is slightly different and complex. So what are all the investigations we do when you come to our hospital? So we're going to take full history, evaluate whether it's acute pain, chronic pain, and then if it is a chronic problem, then we want to evaluate you more with the X-rays, MRI scan. Sometimes we do CT scans, bone density scans, and appropriate blood tests. And the medications we use to cure the back pain is simple painkillers, which are absolutely fine if you are taking for short duration, and anti-inflammatory medications, muscle relaxants. Sometimes if you have sleep problems because of the pain, we may have to use sedatives, because once you get a refreshing sleep, your pains will disappear a lot. Or if you are having anxiety, depression, we need to treat with special medicines. So those are the medicines. So this is the first stage of treatment, physiotherapy medications. Okay, in the physiotherapy, like I already mentioned, we want to strengthen your muscles, improve the flexibility, increase the endurance. Okay, aerobic fitness we want to give. So sometimes you can adopt simple exercise like walking, cycling, swimming. So these are much easy to do rather than going to physiotherapy department and having the exercises. So you can get involved in sports. If you are a young person below 40 years, I would recommend you can do even impact activities. So people above 40 years, I rather suggest do less impact activities like yoga. So if it is acute pain in the physiotherapy department, we can offer you a pain relief physiotherapy, which is a deep heat therapy, ultrasound massage, laser therapy, hydrotherapy, which we put you into the pool of water where we do the hydrotherapy, and electric nerve stimulation, traction. So we have various kits. In Thumbay Hospital, we have a dedicated physiotherapy hospital, physical medicine rehabilitation hospital with very advanced technology. So we have all sorts of equipment to relieve the pain and to strengthen and correct your posture. So if you are not getting better in spite of medicines and physiotherapy, then you reach to the second stage of treatment, which is a spinal injection therapy. So here we give the cortisone injection into various locations in your spine to give you pain relief. Like I said, the back pain is multifactorial. So the pain may be coming from the disc, maybe coming from the facet joints, maybe coming from the muscles, maybe coming from the ligaments. So whichever is the most painful spot, we tend to inject local corticosteroid, which is acting only locally, no effect on your other parts of the body. People worried that steroid means it's really bad. No. So these are only locally acting steroids, and they give long-lasting relief. They give relief for 4 months, 6 months, at least. If not complete relief, lot of relief. So this is the second stage of treatment. If you are still not getting better, then we opt for surgeries. Okay, especially if you have problems with passing urine bowels, or if you have severe leg pains, which means your nerve is badly compressed. So in these situations, we may even opt for surgery. The surgery is again two types. One is to release the pressure on the nerves without any instruments. The second one is we tend to fuse the spine by putting the screws and rods to stop the pain generation there. So depending on your pain and symptoms, we can decide for surgery, but fortunately, surgery is required only less than 5% of patient. So 95% of the patient can be managed just with medicines and physiotherapy. So the take-home messages are, most back pains are simple back pains. So like I said, they can be managed with medicines and physiotherapy. If there is no serious signs, red flag signs, what we call it, you can wait for a few weeks for the pain to settle. So people think that if the pain is not gone in 3 days, 4 days, they get worried. No, sometimes the pain can take even up to 6 weeks to settle down. But as long as you don't have any history of fever, no bowel bladder problems, no history of trauma, no previous cancer problems, anything like that. So it's not a serious back pain. It is a simple back pain. It's just taking long time to settle down. Maybe you are not giving adequate rest. Maybe you are doing the pain provoking activities like too much sitting, too much traveling, too much lifting weight. So until and unless you take out those inciting factors, your pain may persist. Okay. And again, prolonged bed rest or sick leaves are not helpful. So if you are suffering with back pain, don't come and ask us to give 1 month rest, to give 3 weeks rest, because that's not going to change anything. If your back pain is not getting better in 3 days, then we have to look for the other ways to control the back pain. And maintain good posture. Like I said, how to maintain posture. And participate in exercises in the gym or in some sports activities. And avoid prolonged travel and prolonged sitting postures. And most of the times, the back pain can be managed by general practitioners and emergency doctors only. They are good to identify your back pain is a simple back pain or serious back pain. And they can manage if it is a simple back pain for first 6 weeks. Only if your pain is a chronic back pain, they will refer to us. Or if you have a serious back pain, they will refer to us. Until that time, it's perfectly okay to be seen by the general practitioners. Only less than 10% really require a specialist spine surgeon, where we do the injections or surgeries. Both these things, injections and surgeries, are reasonably safe to go through, because many people, they have a really big problem in the spine. Still, they are so scared for surgery that they try to avoid until they end up in a major problems. Thank you. If you have any questions, please.
Thank you, Dr. Mujeeb. It was very comprehensive and very informative presentation, actually. We all need to hear such advice from your side. Thank you so much. I hope everybody enjoyed. And we open the floor for anyone who has any question. We will be pleased. Dr. Mujeeb is here to reply to all your questions. So please just proceed. Yes, please, go ahead. Mr. Ahmed Ahmada.
Yes, hi, good morning, everyone.
Good morning.
Thank you so much, Dr. Mujeeb, for this interesting talk. I have two queries, which is make someone may ask. The first about how smoking can actually cause a back pain. What the mechanism behind that? And the second question regarding the vitamin D. Sure, the vitamin D deficiency is very common in this country. So I wonder if there is any global recommendation for the timing or the day timing when the individuals should be exposed to the sunlight, and for how long it would be recommended to stand on. The second thing about the vitamin D, for some people who take regularly Orlistat, is Orlistat affecting the vitamin D supplementation?
Sorry, what is that? Sorry, the last question I didn't understand. What is that they're taking?
Some people who are taking regular treatment, which is the Orlistat to reduce the weight, and
Orlistat, okay.
Yeah, Orlistat, which is medication to reduce weight and then affects the absorption of vitamin D. So how that will work together? I understand the vitamin D require fat to be absorbed. So Orlistat inhibit the protease and the lipase enzyme. So that affects the fat absorption. Vitamin D definitely will be affected after that.
Okay. Thank you very much for the questions. The first question is smoking. Smoking doesn't directly cause back pain, no. What I'm trying to say is the smoking will cause persistence of back pain. In smokers, any treatment interventions likely to fail. The reason I mentioned in the talk also, the smoking reduces the blood supply, because in the smoking you have so many bad chemicals like carbon monoxides. These things will reduce the capillary circulation. The capillary circulation to the disc, to the muscles, to the ligaments, all these things will be affected. So they will have poor blood circulation. So even any simple sprain, they don't heal properly. So that's why even if you do the surgery, they end up still having back pain. Even if you give medication, they won't reach your medicines, what you are giving to control the pain or to stimulate the healing process, it won't reach to the target tissue. So that's why the smoking will cause persistence of pain. I would say it will not cause directly the back pain, no, but it will cause the persistence of pain. So people who are chronic smokers, if they quit smoking for at least 6 weeks to 3 months before our interventions like surgeries or anything, they will have much better outcomes than people who continue to smoke. So that's what I would say. Second, regarding the vitamin D, the best time is what they say is if the sunshine should have abundant UV exposure, but actually the sunshine will have UV light throughout the day. The time when we can tolerate, that's the time you should get exposed. So like I said, at least 15 to 20 minutes of sun exposure, at least the face should be exposed, the neck should be exposed, and the forearms should be exposed. So that's the minimum recommendation. And the best part of the time, which is tolerable time, is you can say between 7 to 9 in the morning, maybe evening 5 to 7. Regarding the third question, regarding the medication affecting the vitamin D absorption, unfortunately, I have no idea. I'm not a clinical pharmacist. I have to ask the other colleagues. So you have oral vitamin D as well as injectable vitamin D. If you have problems with the oral medication, probably we can adapt to injectable vitamin D, which is a very high dose. Vitamin D is a fat-soluble vitamin, like you know. So if you deposit a high dose, you don't need to take vitamin D for a long time. So vitamin D injection comes in 3 lakhs unit. So one injection can give you nearly 3 months of adequate supply of vitamin D. Thank you.
Thank you, doctor. Thank you, Dr. Mujeeb.
Thank you.
Thank you, Dr. Mujeeb. Yes. Any other question, please?
So I have a question.
Yes, please go ahead.
So doctor, you mentioned about the massage. Is there any relation of pajama or cupping with this back pain?
Yeah, there are various traditional treatments you do for the back pain. So like Ayurveda massage is there, cupping is there, hijama is there, acupuncture therapy is there. So most of these things are relatively safe. So I wouldn't stop anybody from doing those things because they improve the flexibility. So when you come to the physiotherapy department, the people will, our physiotherapist will give massages with machine or pain relief with machines. So sometimes it may not be effective. It may not be as effective as manual therapies. So if you go to the Ayurveda massage, they use their hands to make your spine flexible. So basically, there are small joints in the spine, what we call facet joints. So each level you have 2 joints, right side, left side. So these joints are stiff and painful. So with hand massage, they can make those joints flexible. So in that way, you get good relief. So I don't stop people doing those things. Only thing I will stop is if somebody is going for vigorous manipulation, somebody using a high pressure and moving in completely with lot of force. That's what I don't recommend. But if you are doing manipulation with a trained therapist, it's absolutely fine.
Thank you, doctor. Just one more thing about the junk food. So
Yeah.
any frequency of junk food with this back pain? So should we stop junk food or once in a week is okay? So any recommendation about that?
Unfortunately, I'm not dietitian to tell you exactly the answer for that one. Yeah, I would say that as long as you are not obese, you are allowed junk food. Yeah. But if you are obese, you need to really watch for your diet. Like I said, diet contributes to 70% in your weight reduction program. Exercise contributes only 30%. So until and unless you understand this ratio, you don't realize the importance of the diet. And especially the carbohydrates are the real culprits, not the fat, not the protein. So until and unless we get rid of carbohydrate, it's really difficult to get rid of the excess weight we are having. Thank you.
Thank you, sir.
Thank you, Dr. Mujeeb. Any other question from the attendees? Please feel free to ask. It's the question time. I think there is no more question. Dr. Mujeeb, you have been very clear in this presentation. We thank you so much. It was very informative, inshallah. I hope everybody enjoyed it and we learned a lot with you.
Thank you.
Hopefully, inshallah, we'll have more opportunities to meet and more topics, more informative topics in the future.
Thank you very much.
Thank you. Yes.
I have lots of patients coming from Ajman University, so they are really nice. Thank you very much. And I have to stress again the importance of physiotherapy for long-standing back pain. And I really want to tell again that we have a very good physiotherapy department, dedicated physical therapy rehabilitation hospital. So please do visit and get the benefit out of it.
Thank you. Thank you,
Thank
Dr.
you.
Mujeeb.
Thank you
So much. Yes. Yeah. Thanks.
Thank you very much.
Okay. Thank you everyone for attending, and thank you for all organizers and all attendees. And thank you so much, Dr. Mujeeb.
Thank you. Thank you, everyone. Bye-bye.
Thank you.
Thank you.